Hello, good evening. I hope you can all see me and see the screen, much more importantly than seeing me. Equine dental health and equine dental disease, you could talk for days on this. So we're going to have a bit of a rattle through some anatomy and then some diseases and then some dull legislation towards the end. So equine dental health. So here's a view of the horse's skull, and what we're looking at here is the incisor teeth at the front. Now these little fellows, all they're doing is just trying to get food into the mouth. So we'll see some disease later on, some diseases of the incisors, but they're really there to get food into the mouth. Canines here and wolf teeth, all vestigial and not really relevant to a disease talk tonight. And the molars at the back, 6 on the top, 6 on the bottom, left and right. So 24 molars and premolars, they do all the chewing. They're the most important teeth. So if we can get food down to these guys, they do the chewing and let us swallow. And then the other thing of note is the temporomandibular joint here. We won't be seeing much about the temporomandibular joint today, but that's where the jaw articulates. This is an excellent slide. So what we've got here is this is a relatively young horse, and it just kind of shows you the size of the molar teeth within this skull. So what we can see here is it's virtually down to the bottom of the teeth, the length of this tooth here. So this horse will be early, maybe 2, 3, 4 years of age, that sort of age. But what we can see is the gum level would be along this sort of line along here. So by far the majority of tooth in a younger horse is actually within the jaw, and you see a very short bit of the tooth. And what happens during life is that tooth continues to erupt into the mouth, and the upper and lower jaw come together to wear away the surface at about 3 to 4 millimeters a year. But the relevance of this skull is twofold. One, to show you the length of the teeth, and also to realize that the apices, or the top of the teeth, go high up into the skull into an area called the sinuses up here. So disease that can enter through the tooth at the bottom or in through the side often attracts out here, ending with sinusitis, a snotty nose. The other thing of interest here is just the angulation of these teeth. You'll see the teeth at the back pushing forwards, the teeth at the front pushing backwards. So it's squidging these teeth together on what's called the occlusal surfaces. So they're tightly packed together. Small gaps here, small gap, slightly bigger gap there, but small gaps. And it's because of these small gaps we don't get food impact. And we'll talk a bit later about diseases where those gaps aren't there, the gaps are wider there, and they can be really painful things. So this is our oral a look inside a normal horse's mouth, and this is what we're hoping to look for. So we're looking down the cheek here, a good light source, tongue nicely put. So this big thing here is the tongue. That's a finger. That's not a foreign object. That's a finger. A tongue in here. So we're looking for a nice straight row of teeth, top and bottom. And we're looking for it to be flat from top to bottom, no hooks or ramps at either end. So a little ramping here is quite common. No hooks or ramps on either end at the top. These are the enamel points that when we're doing dentistry, we're taking off enamel points, typically on this arcade on this side and this arcade on this side. So here we can see a nice pink area of tongue, nice pink area of gum. So we've got no sharp enamel points cutting into this cheek here. You're being really pedantic. If you look down, this tooth is possibly a little bit higher. So that'll be a routine dental job, but just be to take a bit off the surface of that tooth to try and get it more in line with the rest of these. Because if you don't do things like that, as the horse gets older and older, that gets more and more and more out of line. So signs of dental disease. What have we got? So here's a little list of signs of dental disease. Weight loss, painfully this little fella's a bit underweight, and so always a good place to start in the mouth. Obviously, lots of things can cause weight loss in horses, but first place to look is the mouth, and then you can work your way backwards. Quitting, this is quitting here. This is where food is dropped. So you'll see these little balls of food outside of the stable or in the stable, and really this is often because the horse has got problems in his molar teeth and doesn't want to chew this food up properly. Often can be geriatrics. So the geriatric horse, which has got a smooth mouth and hasn't got a lot of dental material left in the mouth, finds it very difficult to chew it up properly. Sometimes it can be old age, not an inability to swallow, and other times it can be dental disease. Leaving food patently, horses that leave food, facial swelling. Here, big swelling on the side. So there's still a swelling, there's that swelling in that area there, probably more likely to be grass impacted or food or hay impacted down that side of the jaw here. Swelling up in this area is more likely to be tooth root infection. Swelling can be on the bottom of the jaw. Swelling up in this area can be evidence of temporomandibular joint pain. So any swelling on, so these are the sort of things that you can see by looking carefully at your horse's mouth. And if you have got a sinusitis, that often leads to this stuff, nasal discharge. So if you've got a tooth root infection, infection then goes up into the sinuses. You get pus in the sinuses and abscessation and infection. And these are absolutely stinky. So pretty smelly breath here. What's going on here? This is quite an interesting slide. So here, what can you see the difference? This side, lots of food staining up on the hard palate. This is the hard palate up on the top of the mouth. Lots of food staining. Staining down this side nice and clean. Now that's because this horse only wants to eat on this side of the mouth, doesn't want to eat on this side of the mouth here. It's sore. So what would you do? Careful assessment of this side of the mouth. So these black area here, these are called pulp horns. And underneath there is the sensitive part of the tooth. So the vital structures in the tooth are underneath these black areas that you see around the tooth here. And any disease of these makes the horse very sensitive because right underneath there, it can only be a matter of a few millimeters underneath there will be the sensitive structures. But as I look down here, you really have to get a mirror and a good light source to have a look at the pulp horns at the back or the infundibula, which are in the middle of the teeth, around the edge of the teeth. But there's not much going on in this arcade. And actually the problem was down below here in this lower arcade. This horse had a gap between its teeth, but only chewing on one side. So again, a sign of dental disease. If your dentist is having a look and seeing that, there's a problem here somewhere. But you can often see these horses eating just on one side of the mouth if you look carefully. Poor performance, if obviously they're not eating, excess salivation, any horse that's drooling more than you normally expect, and if it's resisting the bit, always look in the mouth. Good place to start. So what have we got here? I'll just now go through some equine diseases that we see quite commonly. So this disease is we see this EOTRH now. If you think that's a mouthful, this is a mouthful. This is what it stands for. Equine, odontoclastic, tooth resorption, and hypocementosis. Now this is just the disease of the incisors. Okay, so this is, I'm trying to show a normal incisor mouth, normal mouth here. And what are we looking for? We're looking for a nice pink gum. We're looking for the gum or the gingiva to be coming down in a nice triangle here, right down to almost down to the bottom of the tooth. The tooth should be triangular in shape. This is nice and smooth here, no bumps. So this is EOTRH, and this is painful. These guys they're not happy horses. It's more common in older horses, but it's not exclusive to older horses. We don't really know the cause. We think it's an immune-mediated disease, and it's not dietary related, but certainly diet can help a lot with these. So what did you see? Pain, difficulty eating, bitting problems, halitosis, because often you get food impacting around here, gum swelling, tartar on the top of the teeth, gum recession here, so instead of it being down to here, it's being recessed, inflamed gum, and often bits of an abscess coming out here. So sometimes you see, you press on this and you get little draining tracts of pus coming out. Very uncomfortable. Draining tracts and wobbly loose teeth. These teeth become loose. This is a pretty cool video, and this is a horse. You can see this horse. Look at him. Good body condition. This horse is not losing weight. But here's a carrot test. How simple is this to do? This horse does not want to bite into this carrot. There he is, sucking away. He's got EOTRH. Now, so those incisors are only there to get food into the mouth. If they can't get food into the mouth, and perhaps to bite us when they're feeling pretty miserable, but if we can get food into these horses with changes in diet, what happened here, we break up the carrot, give it to him. He wants to eat it. Chomping away on that carrot there now. So if you can get food in the mouth, these horses will do very well. And actually, we'll talk a bit later about treatment. So here's some radiographs of this disease. So this is what we normally see in our incisors. This is an upper jaw. We see normal, this is a normal-ish incisor, so quite elongated, nice consistent whitish colour throughout. There's perhaps a bit of lucency or a bit of darkening around the root, but it should come to a triangle like this. So part of this odontoclastic tooth resorption, this is a type of cell line that resorbs dental tissue. So it's tooth resorption, and what we've got here is this big resorption lesion. So instead of it being nice and white here, look at this. This is like cottage cheese if you took this out in the middle here. This would just be, you know, like an aero bar, just full of holes in the middle. And then hypocementosis, so hyper increased cementum. So cementum is a constituent of tooth, and so you get increased cementum that's being laid down. So instead of this being a nice apical root here going to a triangle, you get these big bulbous things, and that's what causes the swelling on the gum, as well as infection in the gum. So we see all these things on X-ray, and again, look at this. This is virtually broken through here. So these guys lose teeth because they break. It's a pretty ugly slide. Of two advanced cases of EOTRH, and that's the corresponding radiograph to this set of teeth, the corresponding radiograph to that set of teeth. And what you can see here is this tooth on X-ray here is just, that's the edge of that tooth there. Okay, so the rest of this tooth is in the gum here. Is in the gum, and these teeth will be loose. Okay, food impacting between the teeth, so they're no longer stuck together. Loose teeth here, a possible abscess point here because of the infection. Again, this corresponds to this broken tooth. So this tooth here, weak through the middle, likely to break. This one's already broken. That one's already broken, and due to this disease. So what can we do about it? Missed out a slide there. So what can we do about it? This is painful, it's non-curable, okay? So the key is to see these things early. So we've got to be looking for them. Palliative treatment only, really. Analgesics, painkillers, anti-inflammatories, antibiotics, sometimes steroids. These can help, but they won't cure. And so the key is these bottom three. Dentistry, if you've got a sore tooth here and you can reduce the height of this tooth so it's chomping against it less, that can be a useful thing to do. Make sure that the back teeth are okay. Dietary modification, make sure this horse can get food into those molars at the back, okay? And quite often it's extraction. And we often end up taking all of these out and ending up like your poor old grandmother with no front teeth. And they can do very well. And quite commonly, owners will say to us afterwards, my God, I didn't realize my horse was that miserable. And they're like a new horse and brighter and happier and frolicking around the paddock again. And that's all because of chronic pain here. Here's another condition, again, another quite common condition. So a diastema is the name for a gap between two teeth. So we looked at the skull earlier where the teeth were pointing in towards each other to keep what's called the occlusal surface, so this biting surface, neatly packed together like bricks in a wall. But when you get gaps between them, food can impact, okay? These, again, are really painful because what happens is that the food impaction pushes on the gum up in this area and causes gum recession and bleeding, causes gum recession down here below this. And so careful examination. This big fella here, that's a mirror. Okay, so actually the problem is down this row of the teeth, and this mirror here is showing this problem. And we can kind of see with the eye of faith that down here we've got a tooth. But this row of teeth, if you can kind of look, these look misplaced. So these got misplaced teeth here, gap between them, food impacting. And what happens is that you lots of food impacting here, lots of food impacting behind there, and eventually these teeth get loose because the periodontum, which is the structure that keeps that tooth in the mouth, becomes weaker and inflamed and angry, and the tooth will eventually become weaker. And these are sore. can infect both the incisors and the molars, so the front teeth and the back teeth. This is the front teeth. You guys can manage that, and that's with your soft toothbrush and your fingernails. Pretty stinky stuff, but can certainly you can manage the front ones. The back ones are really difficult, but you do need to be very careful with your dental examination because these can be missed early on in the disease. Here's some more pictures. These are both of horses which have both seen better days. So here's a gap, the diastema, and look what it's done to this gum. So this is chronic food impaction has eaten away at this gum here. It's bleeding, and this is deep ulcer, and there's undoubtedly that's going to be very uncomfortable. Here's more sort of common cause. So we just got misplaced teeth. So these teeth are like a row of condemned houses, aren't they? They're just awful all over the spot. So what can we do? You can imagine if the careful dental examination, what we're looking for is, you can imagine the teeth above this, or the tooth right above this area, it's got nothing to chew against. So we'll end up with a sort of downward spike in this area. And if we leave that downward spike on the tooth above it, it's going to be pushing more food down here. So dental attention to the tooth above it, really important. If you've got a sore tooth, reducing the height of the tooth above it so it's not grinding as much on the sore tooth. So what we do is we'll pick out all of this dental, all this food material, and you pack it, you put antibiotic swabs or gauze in here, or little putty foam, impregnated foams that you put in there with antibiotics, or even antibiotics directly, and then put a putty bridge over there so that food can't impact down. They can heal, but they can be very frustrating. Sometimes widening, what we call widening diastomas. So we can see here this little hooky point here. Okay, so food gets caught in this area, and once one bit of food gets caught, second bit gets caught on the first bit, and the third bit gets caught on the second bit. So by smoothing this area off and rounding the entrance, rounding the exits, you can make it easier for food to come in and out, and less to impact. Sometimes actually taking a tooth out. If you took that tooth out there wouldn't be any packing here in front, there'd be no packing behind because there's nowhere for it to go. So that can be very useful actually. These are obviously all veterinary only things that you can do. Dietary modification, really important in these, and I'm sure Tracey. So they've got a group of problems with I just kind of call it abnormal tooth wear, and a whole variety of reasons. Domestication, one, why aren't these teeth wearing out properly? Because we're feeding them soft stuff now. They're not trying to forage through poor quality bracken and bushes and stuff and leaves to get their food. So these teeth aren't getting worn out. Oral pain, we looked earlier about one side of the mouth being sore and the horse completely chewing on the other, so they get abnormal wear that way. Developmental disorders, misplaced teeth, abnormal numbers of teeth, and poor dentistry. So if a dentist has been looking at this, or an equine vet or whoever has been looking at this and has left this big spike here, that's poor work. Chances are this poor horse never had someone look in his mouth. But we can reduce this down and make this a lot better. And here we've got some sharp points. So part of routine dental examination is identifying these sharp points, getting rid of all these sharp points we see up here on the right. And these points here are directly causing this ulcer here. Okay, so that's an ulcer, and look at all this scarring down here. So that's scarring in this area through chronic, basically the sharp points chewing on this teeth, on the side of the gum, big deep ulcer there, big scarred, and all of this is leathery in appearance, showing us this has been going on for a long period of time. Here's a little video, if I can get it to run. And this is, look at the tiny size that this will go in a loop, so you'll see it again. This is right at the back of the mouth. So there's a tiny little point there, you can hardly even see it, tiny point, but it's causing this deeper here. This will be really sore. You can imagine an ulcer in your own mouth. And here we've got a tiny little point. So without good examination, using a dental mirror, you're probably not going to see this. You'll be able to feel it before you can see it. So you've got to get your hands in there, have a feel. You painting as owners can't do that. But to do it properly, a proper examination, have a feel in there, have a look for these little sharp points. Here's just a few of these. Again, things that we don't see commonly, but I just thought that of interest. So again, stressing careful dental examination. Here we've got, if we have a look at this tooth here, this is a normal tooth, that's a normal tooth, and an upper tooth. These white lines that we can see here, that's enamel, okay? These are the really hard bits of the teeth. In fact, enamel in a horse's teeth is one of the hardest naturally occurring substances in the animal kingdom. You know, this tooth will last for 25 years. It'll start life as 3 inches long, and it will grind away for 25 years without wearing out. And that shows you how hard this enamel is. But here, no white enamel. So see all the white glistening through here? No white enamel at all. This is enamel hypoplasia. So this horse has got an enamel issue going on in this tooth, quite rare. But unless this is observed, what would happen is the tooth below it would be much, much stronger, and it would just wear out this tooth really quickly. And then once the tooth is without no use whatsoever, so you need to be looking, looking at your horse's mouth, careful examination, identifying these problems, and something can be done about it. And basically, you'd be rasping the tooth below so it's not wearing out this tooth. This is a really unusual one. So here we can see, as in this case, we've got sort of lines down through the tooth, elongated lines all running in the same direction here, down through the middle of the tooth, all running in the same direction, these pulps, all running in the same direction. This one's completely rotated. So this is a rotated tooth. Very unusual, can't do anything about that. Can't rotate it back. But what you can see is because it's rotated, it's misplaced, we've got food impacting in here. But again, careful examination, knowledge of what's going on, and treating appropriately. Untreatable, treatable. So I'm going to talk now about tooth decay and caries. So caries, unlike humans, which is sugary foods, which we're all probably pretty guilty of, sugary drinks especially. In teeth, most tooth decay and caries is due to what's called cemental hyperplasia. Now, the cementum is one of 3 constituents of tooth. There's cementum, enamel, and dentine. And the cementum, in this case, is around the edge of the tooth. It should be a nice yellow color. So the edge of the tooth should be analogous to glass. It should be nice and smooth, and food shouldn't stick to it. In peripheral caries, the cementum which forms the outside of the tooth is weak, improperly formed, and this is a developmental problem. So you'll have 5 horses in a barn, and one will have this, and the rest won't. And so this side of the tooth is porous. Bacteria can get in there. Mucus can makes a kind of biological soup sticking on the side of this tooth. And eat away the side of the tooth, and therefore it becomes rough. And this is the case we saw with the diastema earlier. It becomes rough, so food collects here, and then it causes gum disease and pressure ulceration. Not normally something that we need to extract the teeth about, and little we can do for peripheral caries, but we can help with diet. And here's some caries on the edge of this tooth. It should be nice and shiny on all these black little pits. Really rough when you put your fingers there and have a feel. So that's the tooth decay on the edge of the tooth. This is caries or tooth decay in the middle of the tooth. Now this is quite an exciting disease in that this is treatable. Now this can take. So there's a center in the upper teeth, not the lower teeth, very, very occasionally in lower teeth, but almost exclusively in the upper teeth. You've got an area called infundibulum in the middle of the tooth that's got, it should have in the middle of this tooth here. And again, we've got weak cementum. So you get food packing in there, bacteria eating this away. So you end up with holes in the teeth and the severity problems are often underestimated. So we see this dark, but again, you only by careful examination you're going to see this, and it's important to see these early because these are definitely curable and treatable. If they're not spotted, no one's looking for them, you'll miss them, and if you miss them, this occurs. So this occurs. So here we've got significant tooth decay here, significant tooth decay is such so that it's broken through the side of the tooth here, gone through there, through here, that tooth falls apart. Probably the most common reason for fractures in upper teeth, typically the first and the fourth, and it's due to untreated, unidentified tooth decay. And these can be difficult to pick up. Here's some videos, and this is one that again has been missed. This has probably been taking a couple of years to get to this stage, or maybe longer. So either no one's looked, or whoever's looked hasn't looked properly. So this, look at all the food in there. I mean, that's just amazing, isn't it? There's half a forest up there. And you can see, obviously, this tooth is broken. You've got a wobbly section here, and loads of food. This will absolutely stink when it comes out. You need to wash your hands thoroughly after doing this job. So that's just a toothpick in there, pulling this food material out. And we'll have a look at the amount of food. I've got another video, much the same. This is a bit further back, even more material in this one. This is an 09. And again, picking this food material out. Look at that. That's pretty cool, isn't it? You can see how black this tooth is. This tooth is rotten and broken. Look at that food material there. But it will take years to get to this stage. So the key is, if we can see these early, we can treat them, and with fillings. Whereas that's gone way beyond what we can fill. So tooth decay, not due to a poor diet, it's a developmental issue. Dietary change will help. Now, avoidance of high sugar feeds, especially rich haylage. So forages that are around, you know, a hay net of rich sugary haylage that the horse is chomping on for 12 hours a day. Never mind its obesity and laminitis, it will kill its teeth as well. So that won't help. It's not purely down to that. It is a developmental, and many horses that do have peripheral caries and infundibular caries, dietary change can help. But these can be filled. So this is an infundibulum here, okay, with a hole in it. These are pulp horns, these black areas here underneath there's where the vital structures are. You can get away with it slightly. These horses aren't often that uncomfortable with these because it's in the non-vital part of the tooth, so part of the tooth which hasn't got a nerve supply. But as it gets deeper and broader, it will start to enter into these areas that are more sensitive. And here's the filling, you know, whatever colour you like. I haven't got a gold one in yet. Here's a little video of drilling out a tooth, which is quite neat. These are basically human machines that we put long handles on. That's pretty cool, isn't it? So we drill them out, get rid of all the diseased tooth, dry it, then we have to clean it, disinfect it, sterilize it, and then once it's sterilized, we can then fill it in layers with human material, with human dental materials. Tooth root infection, so swelling on the side of the face, often up a little bit higher, and that's there's multiple causes for tooth root infection. Infundibular caries, which we just looked at, pulp horn exposure, those little black areas. If you've got a hole through one of those into the sensitive part of the tooth, a broken tooth. Periodontal disease, where you've got around the edge of the tooth where the tooth sits onto the gum. If there's some gum recession there, bacteria can get down there. Hematogenous spread for tooth root infection is rare, but does occur. So that's where there's no dental pathology, and the bacteria in the system settle out on a tooth root. They're quite good because they're treatable. So typically we see facial swelling. Again, like that first one we saw, chewing down one side, chewing down this side because this side is sore. So watch all the food going from here up to this side, being eaten up this side. Nasal discharge, often these are really stinky. Horse can be off colour. So how do we diagnose these? Well, I did looking at the teeth. So you 100% need a mirror. If your vet or your equine dental technician doesn't have one of these in his bucket, then I'd sack him, because you need to or her, you need to be able to look at the occlusal surfaces. The only way you're going to see that is with a mirror or with a scope. You don't need to do it on every horse, but you should have it available to do it with every horse. So careful dental examination, and look at the clinical signs which you talked about, mirrors. Here's a radiograph of a tooth root abscess. So these are normal tooth roots here, sharp points here, sharp point, and here this isn't if there's a long-standing tooth root, often has a clubbed end or a rounded off end. This is still quite a sharp end, but quite a black hole here. Okay, so that's a tooth root abscess down here, and actually that corresponds really nicely. I don't know if you can see it. Corresponds really nicely with swelling just below the jawline there. So this is the mandible, the lower jaw. This is the edge of the bone, the ramus, and this is the swelling on the jaw where the yellow arrows are, and right above it is this tooth root abscess. Now this is a oroscope. So this is a video of an oroscope. This is quite a neat video as well. So this, I will start it and stop it. Hopefully you can see that this is with the eye of faith. This is a big hole in the tooth. Okay, so someone's identified that this tooth has got a big caries in it, or a big area of tooth decay. It's been nicely drilled out and cleaned out and looks great, and it is ready for filling. That's that hole in the tooth there. Can you see that as a big hole in the tooth? But look what's happening here in front of it. This is the front part of the tooth. Can you just see that shining there? See the bubbles coming up? So that's an infected tooth underneath that. There's just a tiny hole in the surface of the tooth, but underneath here, there's a big area of decay, and you've got food material fermenting in that tooth, causing gas bubbles. And you can see that that takes really careful examination. That's a camera, but you can see it with a mirror and you can see it with a head torch. So careful examination, you can see these. But look at that bubbling away. Amazing. Great video. So we've got tooth root infection. What do we do? Well, if it gets to this stage, and this is an untreated caries here. So we can see our normal tooth, broken tooth. So part of it's out this way, part of it's out that way. And that's because someone has missed the fact this horse has had dental disease for quite some while, or no one's looked. So these are action forceps, how we do that. Sometimes antibiotics will work. Occasionally antibiotics work, typically for those ones where there's no damage to the tooth. If it's a lot earlier, we can restore it, put a filling in there. If it's not in this middle part of the tooth, but is in one of these pulp horns around the edge of the tooth, these black areas, endodontic therapy, much the same way as we would have root canal treatment. That's basically root canal treatment for horses. That's an advanced dental procedure, not something we do, but we send it to these guys who do it. But most of the time it gets to this stage, it's extraction. So how do we extract this tooth? Well, it's loose, so we stick the tooth together with a bonding agent basically in the middle of the tooth. Then we have to loosen it, and we loosen it by putting instruments in front of the tooth and then behind the tooth and pushing the tooth. Here's the instrument in the horse's mouth, different side, different tooth. But basically, these are chompers that go together. Now they will squeeze together, which will push that tooth in that direction. Then we'll move them to the front of the tooth, which is across here, and we'll squeeze them, and that'll move the tooth back. So we'll move it back and forth, back and forth, back and forth. And then we'll eventually put a pair of clamps on that. So there's the clamp here, normal tooth, normal tooth, normal tooth, almost very, very commonly the fourth tooth. So 1, 2, 3, 4, clamp it either side, and then eventually, sometimes we used to spend half a day getting one of these out. This horse is awake, it's sedated, it's standing in stocks, it's got its head on a pad, it's not under general anaesthetic. But these, historically, these would have a hole made above it and be bashed out with a hammer. But now we do them intraorally, so via the mouth. And this is what we're aiming for. So this is a tooth pretty loose now. It's the final moments. This is like giving birth. It's absolutely brilliant when it happens, but painful up to that moment. So I'm assured. And here it comes. Here it comes. One more grip. There we go. Look at that. Absolutely beautiful. So that's out in one. Roots are intact. But you can see, look at that there. So that's the area of what we call the crown that's in the mouth, and all of this is in the jaw. So you can see that for a tooth root infection to go from here right up to here, it's got to go right from the top up to the bottom. But the vital part of the tooth will be right from there down to probably about here. So anything that affects this top part will end up with disease going up to the root and a tooth root infection. So another little couple of things here. This is a malformed jaw. Mainly we've got an overshot jaw here, and as I said previously, these incisors are just for getting food into the mouth. But what we've got to be aware of, we see this sort of presentation, is the molars won't be normal at the back. So that should be a big red flag to us to say there's going to be something wrong in the back of this horse's mouth. Here's an additional tooth. So should have 6, 1, 2, 3, 4, 5, 6 teeth. This is an additional one, okay? Rare, so you know, we don't see this sort of thing very commonly, but that needs to be extracted, and here is it coming out. But unless you're watching it, you're not going to see these things. So geriatric mouths. This is normal wearing away of normal dental structures. Okay, so we can see this various geriatric mouths here. Really important dietary modification. The girls afterwards from Dengie are going to talk to you about what we can do for geriatrics, and this is the key for dietary modification, because there's limited amounts we can do for these mouths. These are worn out, often overgrazing on tight palates. Here, an old mouth. We can see virtually, look at all these teeth, they're virtually down to the roots only. Very little enamel left, which is the hard, sharp part. This tooth here is a big overgrowth, and there'll be virtually no tooth, if any at all, below it. So the fact this tooth looks reasonably solid in itself, it's doing nothing because there's no tooth below it. But that's one thing we will do in normal dentistry, is try and keep these parallel. Once it got to this stage in a geriatric, there's very little you can do. And I put up here, less can be more, because you've got to be a bit careful. You don't want to take off the last little vestiges of tooth that the horse is using to chew with. Here's a skull, obviously. And what we can see here is what's called a wave mouth. So if we follow the line of this jaw, there's the tooth here, and then it comes up here and down there, and then correspondingly goes up there and down there. Even the bone has resorbed away. Look at that, the bone has actually resorbed away, and that's from constant pressure of these teeth here pushing into the bone above. And that's part of routine dentistry. Is these occlusal surfaces or tables are as symmetrical as we can make them. Because if we get to this stage, because they haven't been looked after properly as teenagers and younger horses, we end up with teeth overworn and pretty useless archaic. Other things, just threw a few bucket ones in there. A trauma. This horse had probably a kick or some sort of fracture here going on here. So there's a break here. These are eminently treatable if seen. They're quite difficult to treat. We tend to refer them to these guys again. But you can take this bit out. You clear out the basically root canal endodontic therapy. Clean that out, fill it, plug it. Can do very, very well. These are great to see. That's a broken jaw. It's a trauma through the mandible there, and you can wire them the same way as you would use it, and they heal so well. They're really satisfying to do. You don't see that many of them, but they're really satisfying when you get a good one. Oh, this is great, this video. So what's going on here? What's this back here and there? Gold star, if you can tell me before I give you the answer. So there's several of these little things in the mouth. What is that? Now here's an instrument in just getting one of those little fellas out. Look at that, stuck in there. That's something out of Alien. That is a To Fly Larvae. So these little guys will be born, eggs laid on the horse's legs or around the mouth, and then either the horse licking will bring up the eggs and the larvae into the mouth, or the ones that are laid around the mouth will burrow in themselves, and they spend up to a month in the mouth before they get swallowed or burrow their way down to the stomach. Now, we don't see that many of them nowadays because the ivermectin wormer, especially wintertime, kills them quite successfully. But just a great video. This is a horror video, a horror picture. This is tumor in the mouth. Really, really rare. So let's not worry too much, but really, really horrible and rare. So one final little bit. Inappropriate dentistry, that can cause trauma. Look at this. So that's a huge ulcer, deep ulcer there. and that's due to these enamel points not being taken off. So I'd like to think this isn't due to inappropriate dentistry, as opposed to no one's had anybody have a look at this horse's mouth. But if they have, they've done a horrific job, and a deep pulse there. But slightly more horrific is too much dentistry. So here, underneath here, is what's called a pulp horn, which we talked about previously. It's the vital structures in the mouth. And someone has tried to put a bit seat in here, so they thought they're doing a grand job. They've gone too far, and they've gone down too deep. Now, normally what you'd see here is a black hole, a black spot, which is the secondary dentine, which is normally black. If you start rasping away, you'll eventually, it will go from black to brown, then brown to beige, then beige to white, and then white to pink, and then pink to red, and that's bleeding, and you've hit the pulp horn, and you've made a complete haulix of the tooth. So this tooth is now infected, and will die unless it's treated. And treatment for that would be endodontic therapy. It's really quite difficult in horses, but basically taking out the root canal, the nerve, the blood supply, sterilizing it and filling it, and keeping your fingers crossed, because these are difficult to treat. And that's because someone's been being a bit too overzealous with the tooth rasp. So where does that leave us? So just I'd sort of finish with who should do teeth. So do you use a dentist? Do you use a vet? Now there's some very, very good equine dental technicians out there, both qualified and non-qualified. There's also some bad equine dental technicians out there. There's some good equine vets out there who are very keen, or normal vets who are very keen and do a great job. And there's others that perhaps can't be as bothered as they should be, because it's a pretty dirty job and it's quite hard work. Interesting enough, in human fields, to become a dentist is 4 to 5 years at university, and they earn that qualification as a dentist. It is a protected term. So actually, the only person that can use dentist is someone doing human dentistry, because they're qualified as a dentist. There is actually no such thing as an equine dentist. Obviously, it's a colloquial term that we all use, but it actually isn't. So there's legality behind this. So there's now legal control over what people can and cannot do. So veterinary surgeons, due to the fact that they have a veterinary degree and have to register as vets with the Royal College, and have a requirement to do continual professional development each year to make sure that what I learned 25 years ago when I qualified wouldn't stand me in much stead now. So every year I have to spend a lot of time reading articles, reading magazines, and re-educating myself to new techniques. And really, I think the push is to get people who are qualified as equidental technicians to have qualifications, and to make sure they're kept up to date with new techniques. And so there is some legislation behind it. Now, the equine dental technicians, EDT, there's two examining bodies, the BAEDT and the WWAED. So this is the Beaver approved equine dental technician, and Worldwide Association for Equine Dentists. They both have certifiable exams that equine dental technicians can take. They're verified and they're legally bound by the government. And these people have to show that they have the knowledge and the ability to do dentistry well. They're allowed to do extra bits, but interesting enough, this is the unqualified people, that people haven't got these exams. All they're allowed to do is using manual rasps, not allowed to use motorized rasps, are allowed to remove small bits of teeth under 4 millimeters, remove baby teeth, but no wolf teeth, and are allowed to examine the teeth. Now, you can get some unqualified people who do a very good job, but you'd have to think that, and I think legally it will probably come that these people won't be allowed to exist, and they'll all end up having to have a professional qualification, which I think is only right, to be fair. These people can do more, but they can't do acts of veterinary dentistry, veterinary surgery. They're allowed to use motorized dental instruments, where to remove small enamel overgrowths, and the horse should be sedated unless it's deemed safe to undertake the proposed procedure without sedation, with the informed consent of the owner. and the extraction of removal of wolf teeth under direct and continuous veterinary supervision. So even qualified EDTs aren't allowed to remove wolf teeth without a vet being present. And all other structures are in category 3, and these are sort of advanced techniques of dental extractions and basically things that cause pain. And they're acts of veterinary surgery because we're allowed to use drugs and sedation. So if you want a bit more information, look at these 3 websites: the Beaver website, and this will all be on a link I'm sure the girls from Dengie will share with you. The Beaver website, the BAEDT website, the WAEDT website, and they've got information about who can do what in horses' mouths and what we should do. And my final slide is just acknowledgement, and it's really a thanks to Dengie for putting this on. Thanks to you guys for coming and listening to me rattle on, but also a big thanks to these guys. Most of my slides I have stolen from their Facebook page. By all means, look them up. They just got some wonderful dental imagery, and they do a great job. And they're the guys we go to if we're stuck. They're about they're certainly the leading equine dental practice in the country and arguably in the world. But they are down the south coast, so a little bit far to go away. Thank you for your attendance. Claire, I'm done.
Lovely, thank you, Jason, for that's great. If you can stop sharing, and I'll introduce myself and start sharing my screen. I was popping in the chat there. I was like, all of those dental pictures give me toothache. Just the looking at all that food impacted between those teeth. You know how bad it is when you get kind of a raspberry tip in between your own teeth, let alone the amount of food that was certainly between some of those teeth. So okay, I'll crack on with my presentation now if I start sharing my screen. So my name is Tracey. I am an equine nutritionist for Dengie horse feeds. I've been with the company for, I think, about 15 years. I always lose track of time, and I've certainly kind of encountered lots of different dental issues kind of in that time. And I've done a lot of work with a sanctuary that's quite close to us called Remus, who have quite a large elderly population. So I really have advised on everything from the Shetland pony to the Shire horse to the donkey, and even occasionally to an elephant with poor dentition as well. So my talk is on feeding the dentally challenged horse. But before I start talking about what we do when we've actually got a problem, what do we know when it comes to feeding for healthy dentition? Can we feed for healthy teeth? Unfortunately, we don't know, is the long and short of it. Over the last 10 years on the Dengie feed line, we've actually seen a 2.5-fold increase in the number of calls regarding kind of dental issues. So we are definitely seeing kind of an uptick in the amount of calls or inquiries we're getting about horses with poor teeth. So it's certainly attractive to want to know if we can do anything kind of for dental problems. There is some evidence that diet may actually influence the likelihood of dental problems, particularly peripheral caries have probably the most kind of research or evidence kind of linking to them. So of the kind of studies that are out there, the studies tend to be what we'd call epidemiological. So in other words, they're looking at horses that have got peripheral caries and then having a look at what's going on in their life. So that would include diet. It might include other factors like concurrent dental disease as well, for example. But of the kind of papers that you look at, there's a few with kind of different messages. So one of them has found that horses fed between 2.1 to 3 kilos of concentrate per day had an increased risk of peripheral caries compared to those that weren't fed any. Some papers have found that actually pasture access seems to be particularly protective. So horses that had more access to pastures were actually significantly less likely to have peripheral caries, but some papers haven't found that link at all. The paper at the bottom has found that changes in horses' diets from oaten hay, which is typically high water-soluble carbohydrate, to a lower water-soluble carbohydrate hay was associated with significant improvement in equine peripheral caries. And that paper is particularly interesting. It wasn't one in the UK, it was actually an Australian paper. And for those of you that aren't aware, oaten hay is like a whole crop hay. So it's harvested before the oat is mature. So you actually get the oat included as part of the hay ration as well. And they were particularly looking at it in this study because other studies had perhaps indicated that there was more of a significant risk of horses that were being fed oat and hay of actually having peripheral caries. Now, in this paper, they actually looked at the horses over a 5-year kind of period and took photos of their teeth, which some kind of vets then kind of evaluated and looked at the caries over that period of time. And the really interesting thing was that in all horses that encountered caries, they asked them to change their hay type. So if they were on oat and hay, they asked them to change to something else that was likely to be lower in water-soluble carbohydrates. Over the 5-year period, the number of caries was significantly less by the end, and there were some horses that had had really very severe caries that then didn't have them kind of by the end of the study. So the kind of view here is that actually if we make a diet change, then over a period of time when the horse's tooth continues to erupt, certainly with peripheral caries, the tooth can then actually be healthy. There is a bit of a cautionary tale here though. In this particular study, they didn't actually test any of the forages, so they've actually no idea how much sugar these forages had in them, and sugar levels can be highly variable kind of in forages. A previous study where they'd looked at oat and hay, they gave sugar ranges from just under 25%, but as high as kind of 42%, certainly not laminitic appropriate forages anyway. And obviously kind of in Australia, they do rely in kind of drought season, particularly much more on these forages. So these horses would have been chomping down for a long time on these particularly high sugar hays. Not only that, but the other thing we just have to be a bit cautious about is that some of the horses actually got worse with kind of diet change. So it's not just diet alone that's likely to be affecting them. And there were some horses in the beginning of the study that had been on oat and hay, but actually they already had signs of caries that were improving. So there could have been something else going on. So although these studies are interesting, they're not the types of study where we're perhaps feeding something deliberately to a horse and then monitoring the effects. So we don't know that there's a definite cause and effect with these particular studies. What we do know though, and Jason's kind of already nicely covered this, is that even dental wear plus copious saliva production are actually considered important for a healthy mouth. Teeth that are out of alignment certainly increase the risk of food packing, and you've seen that demonstrated really nicely in all of the pictures that Jason shared with us. So as soon as food starts getting stuck, then it's going to kind of ferment, it's going to rot, and you're going to run into problems. Saliva is also really important for a healthy mouth. It has naturally antibacterial properties and acid buffering properties as well. So with, for example, peripheral caries, it's the fermentation by the bacteria that live around the horse's teeth of kind of the carbohydrates that then results in more of an acidic environment and an erosion kind of the tooth. So saliva has a role to play kind of in some of that acid buffering and antibacterial properties as well. It can actually also aid some of the remineralization of the tooth because it's the loss of minerals in the tooth that actually partly lead to the destruction of it as well. So when it comes to dental wear, some researchers have actually had a look at the effect of diet on dental wear. And this group of researchers compared feeding hay with pellets as an example. When eating hay, there is full occlusal contact of the upper and lower dental arcades. So basically, I'm sure you all are aware, the horse's kind of lower jaw is narrower than its top one. And so in order for even tooth wear to occur, you want a nice big sweep of the horse's jaw so that all of the teeth come into contact with each other for more even dental wear. So they found that with hay, you had a lovely big jaw sweep, but when the horse was chewing pellets, then the jaw wasn't sweeping as widely. So that led these researchers to suggest that receiving a diet high in concentrate feeds may require more frequent dental examinations and treatments to avoid the development of dental irregularities. So things like your dental points or hooks, for example. We also know that feed format can affect saliva production. So chewing fibre results in a greater number of chews compared to concentrates. and chewing is directly related to the amount of saliva produced. So the more chewing that the horse does, then the greater the amount of saliva that will be produced as well. So there was one very old study, for example, that showed you've got more than double the amount of chews for a kilogram of hay compared to a kilogram of mixed concentrates. Just looking specifically at saliva production, you can see here in this table the amount of litres of saliva that are produced per kilogram of dry matter consumed. You can see that for the pelleted compound feed, it's only 1.9 litres per kilo, but for grass and hay, it is significantly more. And obviously the horse is going to eat far more of those things and more saliva will be produced. So when it comes to feeding for healthy dentition, what do we know? So probably kind of from those things, one of the things that we are going to suggest for a healthy mouth across the course of the horse's lifetime is to actually keep them chewing. So we definitely want to make the most of forage in the horse's diet, be it grass, be it hay, be it chopped fibre in their bucket feed, to keep them chewing, keep that producing that saliva as much as we can. Above anything else though, and I think certainly this just reiterates what Jason's just told us, is that actually it's maintaining those regular dental checks, spotting an issue early that is probably going to be the most significant factor above diet for keeping your horse's mouth healthy throughout their lifetime. So dental problems, where do we start if you have an issue? Well, first and foremost, you're going to be guided by your vet or your equine dental technician as to what is structurally suitable to feed. So they're going to give you some guidance when you come into a problem. In some cases, this might actually just mean a change in your bucket feed. So for example, we saw plenty of pictures there of horses with the diastema, the gaps between their teeth. And typically the recommendation there would be to actually exclude chopped fibre from the ration, because that's going to have a greater chance of getting stuck kind of in those gaps. So we'll go for something nice and ground and sloppy in those cases. In other cases, particularly perhaps with geriatric horses, so your older horses and ponies, you may need to find an alternative to the usual long stem forage ration. So you may no longer be able to feed hay or haylage simply because they can't chew it. And that is often a little bit more scary. So bucket feed for the dentally challenged horse. So what if you need to remove chopped fibre? So if your horse has got a diastema, what can we pop in the bucket feed instead? Well, actually, that's quite an easy one to deal with, because there's often a pelleted alternative that can be soaked. And if you're feeding a soaked form of feed, it's much less likely to get stuck between those teeth. So really the recommendations there is just to go for a different physical format, and then as per normal, make sure it's appropriate for body weight and workload as well. This is my very elderly pony, Kizzy. She's in her 30s now. And a couple of years ago, at her regular dental check by my vet, he discovered that she had got a diastema, probably senile related. So because she's so old, her teeth have just erupted and she's got a gap kind of over that period of time. So she'd got a single diastema in her mouth. Now that sent me into a little bit of a kind of a tailspin, because I was like, oh, Kizzy, you know, I work for a company that's the UK's favourite fibre feed here, and I feed you your chopped fibre feed in the morning to keep you occupied whilst I'm doing my jobs. What am I going to feed you now? I soon kind of got over myself there and stopped kind of worrying, and just changed her onto kind of a soaked ration instead. She's quite a good doer, so she only has limited amounts of feed. So the purpose I'm using the feed for was to more or less add some vitamins and minerals too. And then I just utilise a bit of hay to keep her occupied at the time instead. Also, we have Alicia Wilkinson, who's one of our supported riders, and her horse Perfect Timing was a really interesting case that my colleague, our performance horse nutritionist Claire, who's working away in the background, actually dealt with. Now, Perfect Timing, or Pooh, as her stable name is, was competing at what was 3-star at the time, is 4-star now, and as a 6-year-old did her first 3 events and suddenly lost lots of condition, which was a real concern. As Jason said, one of the first things the vet's going to do is look in the mouth and have a look, see what's going on there. And lo and behold, Pooh had actually some really unusual dental issues, in that she had diastema between all of her teeth, kind of on the, I think it was the bottom section of her jaw, which is quite unusual to have so many all together. So she definitely required a diet change, and my colleague Claire advised an appropriate ration for her. So she went on to kind of an entire kind of bucket feed, all soaked to a slop. So again, the combination of the alpha beet, some grass pellets, a balancer and some electrolytes, because she was still a performing competing horse. And I think you'll agree that once kind of that issue was resolved, her diet was sorted out, she looks far, far better in this picture. And this is a great study that we love to share, just from the point of view, you know, this is a horse that's competing at a serious level on an entirely kind of fibre-based ration, and one that is actually soaked as well. So it is possible to feed kind of any horse and continue to keep them well. So as I say, from the point of view of it needing to change your bucket feed, that's really, really easy. But where most people tend to go into much more of a panic is if they can no longer, or their horse can no longer chew their forage ration. So why do we need to make sure an appropriate alternative to forage is found and that it's fed at an appropriate quantity? Well, if we have dental issues, so smooth grinding surfaces, wobbly missing teeth, feed impacting, all sorts of things like that, then it can result in a number of factors. So primarily the failure to grind fibre into smaller particles, potentially things like an increased choke risk, maybe an increased colic risk, but certainly potentially weight loss as well, as you saw with poo. And we actually funded some research, it was a little while ago now, and it was carried out by a Writtle College student to investigate just how big an impact poor dentition has, particularly on older horses and ponies that are struggling with their hay ration. And what this did was horses with poor and normal dentition were compared, and their ability to consume 3 types of forage within a 45-minute time frame was evaluated. So the forages that they were offered were either hay, a short chop high temperature dried grass and alfalfa product, which was Dengie Hypocementosis, or a soaked alfalfa sugar beet combination, which was the Dengie alpha beet. What they found was that in the older horses, hay was actually refused on 44% of occasions with horses with compromised dentition. So they simply couldn't manage it and knew it, so didn't eat it fundamentally. Those on the short chop fibre ration refused it much less frequently, so there was only 6% of occasions that was refused, whereas the soaked ration, so the alfalfa and sugar beet combination, wasn't refused at all. And the key message really from this study is that for these older horses and ponies, if we continue to offer fibre in a format that they can chew, then they will eat it. So what am I? I contain over 2.5 kilos of fibre, 100 grams of starch, 500 grams of protein, and 750 grams of total sugar. And I supply about 45 megajoules of digestible energy, which is about 64% of the energy requirements by a 500 kilo horse. I am a 5 kilo portion of hay. So look at all of these different things that this hay is providing to a horse, and this would just be an example of an overnight kind of ration of hay, for example. So it's really important, if the horse can no longer manage this, that we find something that is an appropriate alternative. And one of the ways I find most people go wrong to start off with is that they are trying to increase their amount of normal kind of hard feed, if you like, to compensate for the fact that their horse can no longer chew hay. So when by the time people come to kind of contact us for advice, 9 times out of 10, they probably got about 20 different products going into their bucket, because they're trying to increase the amount of calories to help with their horse's weight, but they haven't really got the hay replacer ration sorted. So this graph here just shows the energy requirements of a horse in light work, a 500 kilo horse, how much energy is supplied by around 10 kilos of hay, which they would very easily eat, and then the amount of energy supplied by this suggested feeding rate of conditioning cube typically, that has about 13.5 megajoules of digestible energy. As you can see, hay actually exceeds the energy requirements for horses in light work, which is actually why we see so many horses are perhaps carrying a bit too much weight these days, but that's a different webinar. But the conditioning cubes fed at the normal typical rates cannot meet that energy requirement, so it isn't going to solve the problem. In addition to that, we also need to be wary of the amount of starch that we're providing, because excessive levels of starch can result in digestive disturbances. There's things like gastric ulcers and colic, for example, would be far more likely. So in this graph on the left-hand side, you've got the upper daily starch amounts for a 500 kilo horse that's suggested. You can see that the hay supplies well below that quantity, but 3 kilos of a conditioning cube is kind of up there. So we can't just keep increasing the amount of conditioning cube to try and help with the weight of a horse that's lost weight because it can't chew its hay, because we would run the risk of increasing the risk of digestive disturbance. So we need to sort that hay ration out. So where can we get kind of fibre from, and in different formats? Now, fibre comes from all sorts of different places. In the horse's diet, it can come from things like cereal fibre, so things like straw, oat feed or wheat feed, for example, which come from around the grain. It can come from things like legumes, like the alfalfa that goes into our feeds, grass and sugar beet. We just need to change the format that these things are in so that the horse, the older horse or the horse with dental problems, can actually choose them. Which of these fibre sources we actually choose in the ration will depend largely on the horse's kind of energy needs. And that's actually determined by the digestibility of these things. So low digestibility fibre sources include things like straw, which is the pale pile at the low end of the scale. And then higher energy, kind of more digestible fibre sources include things like alfalfa and sugar beet, which is at the top of the sliding scale there. So we're going to pick kind of what type of feed is going to suit our horse best according to their needs for weight gain or just weight maintenance. So if your horse can't chew forage, what's next? So basically we could start with grass turnout if it's appropriate. They will 9 times out of 10 still very adequately manage to chew grass because it's lovely and soft and easy for them to chew. Obviously that's not going to be suitable for every single horse or pony, particularly those that are laminitis prone. So we might need to look at alternatives. For grass turnout, we just would need to watch those that do have problems, for example, with their incisors. So, for example, those that have perhaps had their teeth incisors removed because of EOTRH, you know, they would probably be fine on a longer grass, but when it comes to cropping grass as short as in that picture, they may not get enough. So they might need something different. So generally, it just depends on the type of the dental problem that's going on and the suitability, but grass turnout is certainly, you know, a good option. And also, you know, to be quite honest, it's a relatively cheap option as well compared to alternative sources. If you can't manage kind of grass turnout, or the horse has to come into the stable for a period of time, then short chop fibre feeds may be kind of an alternative. But alternatively, if you get to the stage that the horse can't chew at all or has got lots of gaps in between the teeth, then we would be looking at an entirely soaked fibre ration as an alternative. So what feeds are hay replacers? It's really those that are fibre based, so 20% fibre or more. We definitely want low starch feeds, so hay typically contains less than 3% starch. Potentially for those that are laminitis prone individuals, we're going to be looking at less than 10% sugar, and also those that can be fed in large amounts. So you just need to watch for some feeds that perhaps have levels of added vitamins and minerals, for example, are they appropriate to use at hay replacer quantities? And that's where actually phoning and speaking to the people that make that feed is going to be your best bet, because they will know their feeds inside out. To that end, we have a number of feeds that can be used either as total hay replacers or partial hay replacers, according to your need. I'm not going to go through each and every single one of them. They are all there on the Dengie website, and we have actually got a whole dental section about feeding hay replacers and things to give you a good guide. One word of warning I would like to say is if you have previously had a good doer that has then had dental problems and lost weight, if you sort the hay replacer ration out, the likelihood is they're then going to gain weight again. So just watch calorie intake for those that have been kind of good doers through their life. They might need something lower calorie like the Hi-Fi Light, for example, whereas those that are kind of particularly poor doers, then things like the pure grass is going to be kind of more helpful. We also have kind of partial hay replacers as well. So the ones that I just showed you on the previous slide were the total ones, so you could feed those ad libs. But these ones on this screen, we can only feed up to 1 kilo per 100 kilos of body weight. Now, the reason for that varies, but in some cases it's due to a higher oil content, for example. So again, it's just knowing which feeds are most appropriate for the job of being a hay replacer, fundamentally. So the next question is, we've picked our feed. Now, how much are we actually feeding of it? Ad lib if possible, which is the same advice we'd give for any forage. But generally, if you're utilising hay, then we would replace hay on a weight for weight basis with these types of feed. If you're feeding haylage, which weighs more because it's wetter, you actually need to feed a bit less. But you're going to be weighing everything. So one of the one of the big places that people tend to go wrong is we're all very naughty and we utilize feed scoops and measure our feeds by volume rather than weight. If you're using something like a chopped fibre feed, it's very, very easy to underfeed that, whereas it's very easy to overfeed things like cubes. So fibre feeds weigh very little in a scoop, only between 300 to 500 grams of the Dengie ones, for example, but things like pelleted feeds can be nearly up to 2 kilos. So there's a real big difference. So I definitely suggest getting the kitchen scales out if you can. How to feed hay replacers? Definitely in a bucket, kind of rather than a net. That's a question that we get quite frequently, is how do I feed them? If you're feeding outside, put rubber matting underneath. These hay replacers, especially the soaked ones, it's a very messy kind of affair and you'll get lots of wastage if you're outside and they're just kind of popping it in the mud. So something underneath just gives them the opportunity to slurp that all up. Don't soak too far in advance. These soaked feeds will kind of ferment and go off, which will first and foremost affect palatability. So try and soak not too far in advance if you're actually wanting to give your horse the ration. Unfortunately, by their very nature, because they're easy to chew, these feeds will be eaten much more quickly than hay or haylage would be in the kind of a hay net, for example. So you're going to try and divide kind of your hay replacer rations up into small meals through the day, leaving a larger amount overnight, because at the end of the day, we don't want to leave our horses and ponies without anything to eat for very long kind of periods of time. There are tricks that you can do, so things like putting a football kind of in a bucket, trying to use a really wide bottomed bucket so the horse can't take big mouthfuls, are all things to slow them down. You can actually also get some kind of slow feeder devices, and these days they're kind of bigger versions of the dog bowl ones. I haven't actually tried them myself yet, but they certainly look quite intriguing. Just to kind of finish off, this is Bella. She was 29 years old at the time. You can again see that she's not looking her best kind of in this ration. Just looking at her front teeth there, I don't know how you can see that, but you can see her top incisors are really worn down, and that's because she was a crib biter across the course of her lifetime. She always did very well when the grass was long, but when the grass was short, she would struggle because she wasn't able to crop the grazing as much. Now, a few things happened to Bella around the time that picture was taken. You can see there it was around Christmas time. She suddenly lost a lot of muscle mass and she lost a lot of weight. And two things had happened. Firstly, she'd been diagnosed with PPID, and that can certainly result in muscle loss, but also she was been gradually struggling more and more to chew her forage, which her owners perhaps hadn't really appreciated very well, because she was always offered ad lib, but it wasn't weighed. So one of the other kind of important things to do is, if you do offer ad lib forage, perhaps give it a weigh every so often, how much you put in, how much is left, just to ascertain whether your horse is eating an appropriate amount. Now, when she lost this weight, there was all sorts of recommendations from the kind of people on the yard, from feeding barley, conditioning cubes, things like that. So again, the temptation was there to go for the high calorie feeds, but not sort out the hay replacer ration. Luckily, her owner spoke to me, and we came up with a much more suitable plan for Bella. And by the following kind of spring, she was looking much better. So that previous picture you can see was taken around Christmas time, and this picture was kind of the middle of spring. So she'd had a 382 kilo increase. Sorry, she'd gone from 380 to 425 kilos, so she'd had a 43 kilo gain in weight. So kind of more than two bags of Dengie basically she gained in weight. And I think you'd agree she looks a lot better. She's still got muscle loss. She wasn't exercised or ridden anymore, and she'd obviously got PPID, but generally her weight was a a lot better, and that was from simply changing her forage ration. For the majority of that time, she'd been kind of stabled more than she'd been out, and it was just making sure that she'd got something she could manage to eat, and it makes a huge difference to them. We are here to help. If you'd like to talk to us specifically about your own horse or pony, then we can more than happy to give feeding advice. You can either give us a call on the feed line number, or if you have a look on our website, which is dengie.com, there is a feed advice form that you can fill in with all of the details about your horse, so we can get as much information as possible and then give you a personalised ration in return.